Good morning, everyone. Hi there, Justin Leapley with the Medica team. You heard Pat Hefner, my teammate, speak about some updates in the individual space. I'm here to work with your Medicare products and give you some updates for our 2024 products. I want to say thanks, first of all, for your time. This is a really busy time of the year for a lot of people. We don't take that lightly, you taking time to talk to us today. And thanks to ComPro as well, to Justin and Kayla, Brian, the whole team here at ComPro. We love getting to work with the ComPro team and happy they're able to put this together and we get to be a part of it. So thanks for your time. With that being said, we'll get into the 2024 Medicare plan highlights. So I've got some exciting things coming up for you product-wise in 2024. First thing that I want to talk about is our Medicare Advantage plans for this year. So you might have heard about this by now, but one of our three Medicare plans that we have available in the area, it's called a Medicare cost plan. CMS has let us know that we're exiting some counties in Nebraska with that product. So what we did was took this as an opportunity to revamp our Medicare Advantage portfolio. So I'm really excited about AEP. I think we've got some products here that provide a solution for a good amount of folks in Nebraska on Medicare that are looking for a bit of a different type of Medicare Advantage plan. I'll get into the benefits on that here. So the service area, I got asked a lot about this as we lead up the countdown to AEP starting. So this map has a lot of different colors going on with it. Most important thing to probably first notice is in the teal section here, every county in teal from here in Lancaster, or excuse me, not Lancaster, but Custer County to Merritt County and kind of up north and south. We're moving away from cost plans in quite a bit of Nebraska because of information we received from CMS. What we're doing is we're putting 4 new Medicare Advantage plans in all of those counties. So previously, the last couple of AEPs, the last couple sales seasons in the Medicare space, we were selling Medicare Advantage plans in 8 counties, which would be Dodge, Butler, Saunders, Lancaster, Washington, Douglas, Sarpy, and Cass. So that was our previous Medicare Advantage service area. That'll be expanding to 51 total counties this AEP leading up into 2024. So we're going to have a large service area, the largest service area we've had in the Medicare Advantage space in the history of Medica here for Nebraska, largely in part due to the cost plan transition. With that being said, every county that you see in gold there, which I know this might be of importance to some of you, but counties like York, Seward, Fillmore, Saline, as well as the western part of the state and north central part of the state, cost plans will remain. So there's 25 counties that will keep Medicare costed. Medicare Advantage with Medica will be in counties in dark blue and counties in teal for 2024. And then any county that is white, or Dakota County, which is gray, will be Medicare supplement only from Medica. So we'll have a Med Sup statewide heading into 2024. As we have the past year or two as well. We'll have a Medicare Advantage plan in 48 counties in Nebraska, 3 in Iowa, and then we'll keep Medicare cost plans in 25 counties. So at Medica, we're still going to keep the cost plan in counties where it makes sense. And essentially, the transition part of the cost plans is really triggered by Medicare Advantage sales and Medicare Advantage penetration in those counties. If you have other questions about that, we can definitely get to those at the end. I know that that's something that's important to discuss, so I can get into that a little bit further later if you'd like. 51 counties total, as I mentioned, between Nebraska and Iowa. There's 4 Medicare Advantage PPO plans for that. One of those 4 products is a Medicare only plan, or that doesn't include Part D. So 3 of the 4 Medicare Advantage plans will have a in and out of network benefits in addition to Medicare Part D. And then one of those plans will have a $0 Medicare Advantage only with no Part D. So maybe somebody who's a veteran or has Part D drug coverage through another route may want to look at our Medicare Advantage only plan for 2024. I want to start off with what I think is one of the strongest things that we bring to the table at Medica leading into the 2024 Medicare sales season, which is an incredibly strong local network here in Nebraska and really a dedicated approach to provider relationships. In Platte County, we'll have an exclusive Medicare Advantage network contract with the Columbus Community Hospital. That was a huge win for us at Medica. Historically, Medicare Advantage plans weren't able to become in network with the Columbus Community Hospital in Platte County. So I'm really happy to announce that we have that for 2024. So anyone in or around Platte County, please have confidence that the hospital there and Medica have an outstanding relationship. In addition to that, Mayo Clinic. So Rochester, Minnesota's Mayo Clinic, our kind of home base for Pat Hefner and I in Minnetonka, Minnesota, which is the corporate headquarters for Medica, actually insures the employees of Mayo Clinic there. So our commercial team in Minnesota provides the group coverage for the employees and the staff of Mayo Clinic. They're also an exceptional network partner too. Of course, Bryan Hospital, CHI, Methodist, Nebraska Medicine, a really strong provider network throughout the state of Nebraska, from Omaha to Lincoln to Scottsbluff and everywhere in between. So I think if anything, hopefully after we're done today, you can see that there's a lot of value in working with Medica, and you can have a lot of confidence in the network that we're bringing to the table in Nebraska. So looking at the 4 products here, there are 4 Medicare Advantage plans for 2024. I'm excited to bring 4 new options to the table and have the largest service area that we've ever had on Medicare Advantage since we've been here at Medica. Probably the highlighted plan that I want to start off with, and I'll probably talk about the most today, is the Medica Advantage Preferred Plan. So it's $132 a month Medicare Advantage plan, $2,500 maximum out of pocket. So with everything going on with cost plan transition, we decided that we wanted to create a product that looked very similar to the cost plan, but then put that on the a chassis essentially, or a platform of the Medicare Advantage plan, including Part D drugs. So I think benefits wise, for a Medicare Advantage plan, this is as comprehensive coverage as I've ever seen. I think this plan does a great job of protecting your clients' cost and exposure for doctors and hospitals. And I've heard for a long time since I've been here at Medica that it would be nice to have the Medicare cost plan was never available in areas like Omaha or Lincoln. It's still not available, the cost plan in Omaha or Lincoln, but we have designed a plan here that I think finds a solution for a lot of folks in the eastern part of Nebraska that are on Medicare and perhaps paying quite a bit for their Medicare supplement. I think this is a great option for those folks, because at $132 a month, the maximum out of pocket's at $2,500. And as I start to go through the benefits here, I think you'll see that that's going to be hard to reach that $2,500 maximum out of pocket. So your preventative care, physical exam, primary care, all of those are $0. Specialist is a $10 copay. It's also an important call out with this plan that physical therapy and chiropractor is also going to be a $10 copay for in-network. All 4 Medicare Advantage plans, whether it's the value $0 plan, Select 26, or the Medicare Advantage only plan, they all have what's called a combined MOOP, so a combined in and out of network maximum out of pocket, meaning that regardless of where your client's at on these products, they could have ultimate peace of mind that even if they were to see an out-of-network provider, that maximum out of pocket caps at $2,500 on the preferred plan or $3,900 on the value plan. In addition to that, going back to the preferred plan, the benefits are very competitive across the board. The one thing you'll notice on this particular product, kind of 2/3 of the way down there, is on the Medica Advantage Preferred, you have $100 per stay inpatient hospital copay. So I haven't seen a Medicare Advantage plan that has that here in our market. I think that there's a real opportunity for that. So $100 per stay, regardless if someone's in the hospital 5 days or 50 days. If they're here in Lincoln at Bryan or St. E's, wherever they happen to be, $100 per stay. I think that is going to be a really attractive option to a lot of folks in Nebraska that are maybe paying $300-400 a month for their Medicare supplement. They want to have some extra benefits, some ancillary coverage, and then also the peace of mind that when they go to the hospital or go inpatient in the facility like that they're only going to pay $100. The other thing too that I want to call out in relationship to that $100 per stay copay is that it's a bit more of a provider friendly approach, I feel like, to a Medicare Advantage plan. Oftentimes when we're meeting with hospital systems and talking about Medicare Advantage contracts, one of the things that I think helps alleviate some of the concern of those facilities is not having to chase dollars and not having to run down $3,000, $4,000, $5,000 when they treat a patient inpatient. I'm hoping that helps solve a problem for that too, and becomes, we're hoping, the goal here is to get through AEP and have this be very much a a huge successful AEP, but also something that's a good fit for your clients. They have peace of mind in, and then our provider partners as well too. So we want our providers to have as good of an experience as you hopefully do as our sales partners, and hopefully your clients and our members do as well. The skilled nursing facility care is going to be $150 per day on the Medica Advantage Preferred. That's for days 21 through 40. I don't know if you'd get all the 40 days on that. That would probably cap off when somebody reached their maximum out of pocket at $2,500. Going back to the Medicare Advantage only plan, that plan is going to have a $265 ground ambulance, $100 ground ambulance on preferred, and then $250 on the value and select. So we really try to build a very comprehensive benefit package here for you. The travel coverage on this plan is going to be designed by providers that accept Medicare nationwide. So at that point, if you have someone that's here in Nebraska, they're using this Medicare, any of our 4 Medicare Advantage plans in other states, the provider is just going to need to bill Medica directly like they would with any other Medicare Advantage plan. As long as they accept Medicare, then in-network benefits will get paid on that. We are recommending that the members call into customer service to activate that benefits. If somebody doesn't call in prior to traveling, I don't want you to have to worry about that or have any concerns about that. The member can retroactively provide that date range. I don't think this will be too much of a concern this sales season and into 2024 as your clients start using these benefits. I feel confident that there aren't going to be any claims held up. There's not going to be any service abrasiveness or anything like that. So member can be gone for up to 6 consecutive months for the benefit to be applied. Any questions so far? Good. The Part D portion of the Medicare Advantage plan, I think the important call outs here would be a $0 deductible across all 5 tiers of drugs. So no deductible on any of our 3 Medicare Advantage plans here. The very low cost, inexpensive drugs that are in tier 1 are a $0 copay. Tier 2 is going to be $10, $12, or $14 depending on the product. Tier 3 is a $47 copay, which I think tier 3 is really probably that most important tier out of these 5 when it comes to a Medicare Advantage plan. I can tell you we have Eliquis in tier 3 for next year. We also have Xarelto in tier 3 as well. So that should be a really, those 2 are pretty commonly utilized medications by Medicare beneficiaries, and they also are quite expensive. So I'm excited about that benefit. I think this product and the formulary on it will do a nice job of protecting your client's spending when it comes to their pharmacy costs for this year. Extra benefits and services. So like most Medicare Advantage plans, a big piece of the upside when somebody's looking at this plan, regardless of if they've been on Medicare for previous years or not, or if they're brand new to Medicare, I believe that this particular part of Medicare benefits specific to Medicare Advantage plans is a huge part of the equation for the shopper and for the customer. And I think you'll continue to see more and more of that as we move on further into the Medicare Advantage space here in Nebraska. The dental allowance is $1,500 per year. So clients on the preferred plan, which is the $132 a month premium, would have up to $1,500 per year in dental coverage, $700 per year on select, and $600 per year on value. The Medicare Advantage only plan, so a plan that doesn't include Part D, is going to have $1,000 per year in dental coverage. OTC, I think out of all these extra or ancillary benefits, it seems to me, just from talking to our customers and to agents like yourself as well, the over-the-counter benefit is a pretty high utilized portion of these benefits. So $75 per quarter on preferred and the Medicare Advantage only plan, $50 per quarter for value and select. So again, 4 Medicare Advantage plans for 2024. Really like that $1,500 dental benefit. I think that's something that anyone who signs up for our plan will definitely like to take advantage of. The other good news about this product is there's no network here. So for dental and for eyewear, you don't have to worry about a network. We actually are introducing a Health Plus by Medica card that I'll get into more on the next slide. We've actually wrapped up dental, eyewear, and OTC into one card with a retail component as well. So I'm pretty excited about that. But for vision coverage, there's $300 per year on Medica Advantage Preferred, $200 per year for the Medicare Advantage only plan. as well as select, and then value is going to have $150 per year. The Epic Hearing Program is the only piece of these extra benefits that's outside of the Health Plus by Medica card. And the way that works is we partner with Epic Hearing Program, $0 copay for your clients if they need to get a hearing exam done. And then basically there's just two different levels of hearing aids. So a $549 copay for the kind of mid-range or silver level hearing aid, as Epic calls that. And then $799 gets you what's the most premium hearing aid that's available through this Epic program, which is a gold level hearing aid. And then of course the fitting and evaluation follow-ups are a $0 copay as well. So Health Plus by Medica card. So dental coverage, eyewear, and OTC is all going to be wrapped up under one card. So if you write one of your clients this fall, hopefully on a Medica Advantage plan, they'll get two ID cards. They'll have a member ID card that'll say Medica on it. Just as Pat had showed you earlier in the IFB space, it'll look very similar to that. So they'll get an ID card, of course, for the Medica Advantage plan, and they'll also have a Health Plus by Medica card. This was a change that I was really excited about. We listened to your feedback a lot as agents. Your opinion definitely matters a ton to us, and we always try to take that and do what we can to make things better, make your day easier, make less phone calls, take more things off your plate so that you can hopefully focus on growing new business or whatever it is that your interests are within your business. So with the Health Plus by Medica card, this comes into us from agent feedback. Anyone that's worked with our Medicare products before knows that this was very much a manual process. It definitely wasn't what I would call agent-friendly or customer-friendly. Paper reimbursement forms, waiting 30, 40 days sometimes to get reimbursed back. So I think it was better than nothing, but I think it could be better, and I think it is better now. So having the dental coverage and the eyewear and the OTC all wrapped up under one card, there's still no network on this. So it's really technically not even a reimbursement anymore, but your clients will get to take advantage of the fact that there's no network. So depending on where you're at, dental networks are oftentimes limited, or it may not be that easy to get in for dental work. Whatever the situation may be, this should take care of a lot of those pain points when it comes to seniors using their dental coverage, because the $1,500, for example, on Medica Advantage Preferred is going to be preloaded on the card. And in addition to that, $300 on eyewear for Medica Advantage Preferred, and then $75 per quarter for OTC. So if you think about this, your client can, within the same day, go to the dentist, swipe the Health Plus by Medica card, and if they have a cleaning for, let's say, $200, they're going to swipe that card. The merchant code is going to sync up with the $1,500 benefit in the Health Plus by Medica card, and the member's going to get a quarterly statement that says, okay, now you have $1,300 left in your dental benefit. Go to the eye doctor. They can go to any doctor, any eyewear location, or freestanding vision center that accepts Visa. So from a dental and eyewear network perspective, this is going to be very, very easy for your clients to use. Also, another thing I'm really excited about, OTC has a retail presence now for our Medica Advantage customers. Previously, this was something, if you sold a Medicare cost plan with us before, or if you worked with us with Medicare Advantage before, you might know that this OTC component in partnership with CVS was a call-in or an online order only. That is no more. There's a retail component that we got added to that, which I again think is a pretty great deal. So your clients that are on any one of the 4 Medicare Advantage plans, they can purchase OTC items the same traditional ways that we've had in the past. So calling the 800 number or going online. But I realize that's not everyone's preference. Depending on where the person's located, it might be a big deal that they can go down the street to local Dollar General, or go to Walgreens, or go to Walmart or Family Dollar. So there's going to be a retail component as well. So for the $75 quarterly OTC amount for the preferred plan, your client can have the flexibility to go to a number of different retail stores for that. Members can also shop online at mybenefitcenter.com, or they can use a mail order catalog by phone. So I spent a lot of time talking about Medicare Advantage plans. I want to circle back and touch on Medicare cost plans here. So the cost plan service area reduction impacts 4 states actually for Medica. So Medica sells cost plans today in 10 states. So 4 of those 10 states are impacted with the cost plan service reduction. I would say, we found out about this earlier in the year, late spring, early summer, and it's been a lot of work trying to get everyone ready. But I think we've done hopefully a good job of trying to be clear and transparent with you about what we have going on and what our plan is in place to give current cost members a really nice alternative, and hopefully to grow some new business as well too. I'm looking at that Medica Advantage Preferred again. But Nebraska, North Dakota, South Dakota, and Missouri all have a change in cost plan service area. So the counties that we can sell cost plans in. The greatest impact is definitely in Nebraska in terms of the size. There's quite a few members this impacts in the Dakotas as well too, specifically South Dakota. 3 counties in Missouri, cost plan is moving away from, but the very minimal membership there. So definitely impacts Nebraska quite a bit. I wanted to show you that we're still expanding cost plans where it makes sense. So in Wyoming and Wisconsin, we've added 5 counties in Wisconsin, 3 counties in Wyoming. I just want to show you this mainly to kind of hopefully let you see that Medica is still going to look at where it makes sense to expand cost plan coverage. I think there's quite a bit of opportunity out in Wyoming. And where would we go to expand cost plans in the future? Definitely would be places where there's a very low Medicare Advantage penetration and pretty high cost of Medicare supplement plans. I would say that's probably a pretty good starting point of the counties and the states that we look at on where to expand the cost plans. Member communication plan. We've tried to be really transparent throughout this whole process because it affects several thousand folks in Nebraska. So we're trying to be as as accurate and as diligent with our follow-ups to you, our agents community, as we can be. So in late August, a letter went out from Medica to current Medicare cost members. It explained what's going on, the CMS requirement associated with cost plan exit, and what the next steps were. A required CMS communication is set to go out in about the next week or so. It's not from Medica. It's from federal government and CMS. It'll indicate that cost plans for residents of 40 counties will be ending at the end of this year. Invitation to member meetings will go out about a week after that. So myself and our Medicare licensed team will be with me this fall. We'll be doing a ton of member meetings all across the state of Nebraska, roughly about 80 meetings at about 15 different locations. So we're going to be all over the place, talking to hopefully you there, agents. All agents are welcome, our current customers, your current clients, and we'll be out there doing a presentation to explain, hey, this is kind of what's going on. This is what our direction was from CMS and federal government about cost plan transition. And here's what we're doing about it. Here's our new products we've designed. We've got a really strong network. And I think we have a good story to tell to try to make the most out of the situation. A recommended plan will go out to current members right around October 1st or 2nd. And then a notice that enrollment begins, AEP begins October 15th, goes out right around that same day, 10/15. Mid-November, a friendly reminder to enroll in a new plan. And then, of course, with AEP concluding on December 7th, a final reminder to enroll in the new plan. So if you have cost clients today, thank you for working with Medica on that product. I want you to have as much peace of mind as possible that we're here to support you. Thank you for trusting us in doing that. And I feel that we do have a good plan in place to help successfully navigate this AEP. So our response, a highly competitive 2024 Medicare Advantage plan. It's going to be offered in the Dakotas as well as here in Nebraska. Our communications campaign is going to educate yourself and your members every step of the way. And the member events, I think, will be really the most impactful piece of this equation. We'll have enrollment staff on hand. We'll have enrollment sign-up rooms. We'll have a bunch of different folks there that are licensed and certified to help check client drug list, provider list, all these types of things to make sure that everyone feels as good as they can about this transition. And here's a plan comparison example. I think this hopefully paints a pretty good picture of where we were at and where we're going. So the Medica Prime Cost Solution Premier Plan, it's $130 a month this year. It's actually going up to $140 in 2024. The maximum out of pocket stays the same at $3,000, same $100 inpatient hospital copay. But in the center column is the Medica Advantage Preferred. So again, I'm excited to be able to have this in Omaha and in Lincoln, but then also to give this product as a really nice transition from our Medica Prime Solution cost members to the Medica Advantage Preferred plan. So current Medicare Cost Premier members are going to, those that move over to Medicare Advantage Preferred are actually going to be getting some stronger benefits than they even have today. So their maximum out of pocket is going to go from $3,000 to $2,500. That inpatient hospital copay is at $100, as I mentioned before. actually 1,100 more in dental. So dental is going from $400 to $1,500. Eyewear is going up $100 as well, from $200 to $300. And OTC is going from 50 to 75. So these member meetings that we'll be running, I should be there at pretty much all of those, and I'll be talking about this. Here's what the plan was and here's where we're going. So we've got a really good plan in place with as strong of a network as you'll see in Nebraska to back it. I feel really confident that this is going to be a product that folks in Nebraska are going to be excited about and have peace of mind when they use it, not only in Nebraska, but when they travel as well. So with cost plans, as I mentioned, we're able to keep those. I shouldn't say we're able to keep these in 25 counties for 2024. The same 4 plans come back. So if you've worked with us on cost plans before, nothing changes in terms of the names for those plans. Standard, Thrift, Core, and Premier. Return for 2024 will be in 25 counties. These plans are still, if there's still a good solution and a good fit for someone, I don't want you to be too nervous about putting someone on them. Hopefully you can see based off what we're doing with the Medica Advantage plan, that if this were to happen in one of these other 25 counties for 2025, that I hope that you can see we have a good plan in place, and we're always going to do what we can to keep your best interests in mind and your clients as well too. So for the 4 options on Medica Prime Solution for 2024, the biggest callouts, just kind of quickly going through this here, would be the Premier plan at $140 a month. That plan is $130 this year. It was $125 in 2022. So if anyone asks you that, or if you're curious about that, that plan went from $125 a month to $130 a month, and then now it's $10 more a month at $140. So that's an important call out. Any current cost members that are keeping this plan, that are able to keep this plan in 2024, will, if they haven't already, they'll get notified of this via the ANOC letter, Annual Notice of Change letter. The core plan is $82, Thrift is $43, and Standard is $0. Probably, we have several thousand folks on these plans in Nebraska. Probably 91% of them are on the Premier plan. So, and most of them are in an area that these plans are transitioning to Medicare Advantage. So just hopefully you can see through all of this today that we're going to have a plan in place, regardless of the county that your client resides in. The other big change on the Premier plan to call out would be the outpatient surgery copay. I believe this was $0 to $50 this year. In 2023, that'll become a $50 to $100 range for outpatient surgery. Skilled nursing facility, still a really low benefit at $25 per day, days 21 through 100. And again, just like it's been in the past, I think probably the biggest potential spend for one of your clients on this plan would be a 20% coinsurance for Medicare Part B injectable drugs. Same $100 inpatient hospital copay, and still a viable option in some of the counties that we have it in for those that are for the same reason that thousands of folks in Nebraska have bought this plan before. Can no longer afford $300, $400 a month for a Medicare supplement. And you can still write these plans year round. So nothing changes there. So if you have a client or a prospect in one of those 25 counties, you can still write this plan for a 2/1 effective date of 2024 or 3/1 or whatever it happens to be. Extra benefits and services, not a whole lot of changes here for the Medica Prime Solution cost plans in terms of ancillary benefits for 2024. Dental, eyewear, and hearing aid all remains the same ancillary benefits that we've had this year as well. So no changes there. $400 on dental for Premier and Standard, $300 for the core plan, $150 for eyewear on Standard, $100 on core, $200 on Premier, and then $400 for the hearing aid reimbursement. So no changes there for that. We kept OTC the same as well. It's $50 a quarter on Premier and core, and then $25 on Standard. I unfortunately don't have yet the Health Plus by Medica card on these products. That's going to be exclusive to the Medicare Advantage plans for 2024. Hopefully coming back in 2025, we can have that Health Plus by Medica card added to the cost plans, but I don't have confirmation of that yet officially. So that was a quick run through cost plans. My third and final product to talk about to conclude with you today would be our Medicare supplement plans. So we talk a lot about Medicare Advantage plans. You hear about that a lot from either us or from other carriers. We have this unique product that's leaving a good part of Nebraska in cost plans. And then of course there's the old tried and true Medicare supplement, which At Medica, we're writing a good amount of Medicare supplement each month, so I still feel it's a viable option. And you can keep me honest, but I'm pretty sure a lot of folks that are T65 or retiring from their employer group coverage at 66, 67, 68 years old still see a lot of value in Medicare supplements, and the premiums for those folks remain pretty competitive as well. So we'll have Plan A, Plan F for those that are eligible prior to MACRA guidelines, G and N. So we have the same Medicare supplement products coming back. Probably the most important thing to talk about, I think, for our Medicare supplement product is 6/1, June 1st. That's our rate change time of year every year. Full transparency, we took a 3% decrease June 1st of 2021, and then we had an 8% increase June 1st of 2023. So curious to see what our new rates will look like 6/1 of 24. I won't have any idea what those will be till March, maybe April is when I usually get that information. So I'll make sure to let the team at ComPro know so that can get communicated out to the agents as well. But obviously hoping for, if it is an increase, hopefully, obviously we want to as low of an increase as possible, if not a decrease. So I really don't have any earthly idea what that'll look like yet, but I just wanted to remind everybody that 6/1 is when our rates change. And our rates in our rate books now, those remain the same throughout May 31st of 24. We do have a 12% household discount. So if someone that is applying for Medicare supplement coverage lives with someone that's 60 or older, it will receive a 12% household discount for that. Applications for Medicare supplements can be done at the MedSup portal of your Medica.com broker section, or whatever other enrollment tools that you use here through the team at ComPro as well. Like with anything EAP questions, product questions, please always feel to reach out to me. I try to keep in, at least weekly contact with the team here at ComPro as well to kind of get an idea of what's going on in the field. So please don't forget to reach out to us if we can help with something. And why sell Medica? Pat had touched on this earlier. I think, hopefully you can see at the end of the day, we're a very transparent team here. We have an exceptional local team here in Nebraska to try to support you. A really broad portfolio of products, whether it's the ACA under 65 space, or when it comes to Medicare. I think that, we've had a lot of work going on since we started doing cost plan transition, but I really feel that we're in a good spot. We have a great local team you can trust. And at the end of the day, the added benefits in the Health Plus by Medica card, those are really thanks to your feedback. So please keep suggestions up, feedback, keep the questions coming, because it absolutely helps us do our job better. And I'm excited for AEP. I hope that you have a great AEP and have a lot of success. And please know that we're here to support you with a great portfolio of products and a really strong network. So thank you.
We have a couple questions in the chat, Justin. The first one is asking if enrollment books will be the same format as they are currently.
Yeah, is that enrollment books in terms of Medicare Advantage?
I believe so. It was an early question, yeah.
Yeah, those would look and feel the same. Is that question coming from, is that not working well that way? Would you prefer, I know some other companies put it like an application and an enrollment portfolio in with the product brochure. Would that be something that you would like to see more than how we have it today, which is like
if the asker of this question wants to unmute and ask it, that would be great. Okay, they say yes. What you're saying is that might be better. So
to have like the product portfolio in there and then have the app, maybe have a scope in there as well, if possible.
Yeah, they will have like the benefits, summary of benefits, the application. The application, I guess I don't really care about because I do everything electronic.
Mm-hmm. All feedback is definitely
like some other companies' booklets. They're like UHC.
Mm-hmm. Yeah. If you, I've heard that a couple times from agents as well. So if that's something that's valuable, do you think that would help your day to day during AEP when it's busy and chaotic?
Yeah, because I'm kind of stumbling through the cost plan now. I'm like, okay, I don't know.
Yeah, I'll share that feedback with our product and our marketing teams, and we'll see if we can make that change happen, if that would make the day to day easier. definitely.
Thanks, Justin.
Thank you for the feedback. I appreciate it.
Another question that we have is if you could talk about the $35 insulin benefit on the cost plan.
Yeah, so the $35 insulin benefit will be a part of the Medicare cost plans or the Medicare Advantage options that we have for 2024. So that'll be capping or limiting, capping that spend at $35 for insulin. I don't know if your question, if you want more specifics on brands or do you have more of a follow-up to that?
I'll let the asker come on and ask us, or come on and let us know.
Hi, Justin. The question I have is, maybe I missed something, but I didn't think that the cost plans had prescription drug coverage.
Oh, yes, yeah, that's correct. Yeah, they don't have Part D. Yep, so the Part D coverage is included in the Medicare Advantage plans only. Yeah, I'm sorry, I may have answered that incorrectly before. So Part D, everyone that's on the cost plan or anyone that is sold the cost plan going forward, they have their own Part D drug plan. So yeah, sorry, I might have miscommunicated that. So anyone that's on Medicare cost, they're buying some kind of a separate standalone Part D. So the insulin coverage wouldn't impact that like it would the Medicare Advantage plans that include Part D. The only part of drug coverage that's included on the Medicare cost plans is injectable drug coverage. So the Part B drugs, things like Prolia and different types of injectable drugs, those are included in those types of injectable drugs have coverage in the Part B benefit of the Medicare cost plans.